Welcome to Shorr Solutions, the podcast, and I'm your host, Jay Shorr, CEO and founder of Shorr Solutions. We are a team of national and award-winning practice management consultants with experience running a multi-million-dollar cosmetic dermatology and plastic surgery practice. We're here to share strategies and insights that will help you grow your practice efficiently and profitably. In each episode, we'll explore the steps and actionable insights to guide you through your journey to increase efficiency, boost revenue, and decrease costs. Tune in and discover how to improve your patient experience and take your aesthetic practice to the next level. Welcome to another episode of Shorr Solutions, the podcast. And our title today is Connect, Learn, and Grow: Why Conferences Matter for Your Career. And today I have the honor of having a very special guest on today, Dr. Randy Waldman. And Dr. Randy Waldman and I go back a long way at the start of these conferences. And Dr. Waldman is a facial plastic surgeon in Lexington, Kentucky, with WaldmanSchantzTurner. He is also the founder, organizer, and program chair of multiple conferences, inclusive of MAC, Global Aesthetics, and formerly VCS, the Vegas Cosmetic Surgery Show. But presently, now it's just Global and MAC. And we have one coming up very, very shortly in Hilton Head. And I'm certainly looking forward to that. This is a resurgence. So welcome, Dr. Waldman, and thank you for taking time out of your busy day to meet with us.
I appreciate it, Jay. Thank you very much for having me on. It's truly an honor. And we have done a lot of things together over a fair number of years. We won't say how many.
Well, I don't know that I even had hair then, all right? So it really won't matter. But for those of you that will be listening in the future, I really want to share that Dr. Waldman is a very instrumental part in my growth and development in this industry as far as being faculty, organizer, course directors of different things, because I started after selling the practice, right, even before selling our dermatology plastic surgery practice. And Dr. Waldman was gracious enough to have me on one of the originating conferences.
Well, it's definitely been a great relationship, and I appreciate all the help that you've given us over the years. And you were one of the first innovators to really recognize, along with me, the importance of teaching people how to run a business, how to run a practice, which is really a business. And we started that process 20 years ago, long before everybody else really decided that it needed to be a small part of their program. But as you know, it's not a small part of our programs. It's an essential track that is every bit as important as any of the clinical tracks. So I think that you were very instrumental in those early years in helping kind of guide my process and my thinking process. And, it's developed and come a long way since then.
I'm very big with education. As a matter of fact, everyone who knows me knows that I am on faculty at Florida Atlantic University in the College of Executive Education, teaching medical business management to physicians, people in med school, and people that want to enter this field. My whole world is about teaching. I don't like to get into the politics of everything, but to me, it's all about educating people who want to get into the medical profession, whether it is a surgeon, whether it is a core physician, even whether it's a nurse practitioner, physician assistant, associate, whatever they want to be called now, estheticians, and even office management. Because one of my key slides that I always share, that medicine is one of the most respected professions today, but we never lose sight of the fact that medicine is a business, and that's why we're here. So let's get right into the meat and potatoes of what we'd like to speak about, and that's why should you attend conferences? Dr. Waldman, you run two of the larger conferences domestically in our industry, and I always want to know, people say, well, why should I attend a conference? And there's three main answers to that. The first is to network, because some people don't have any other way to see your old medical school friends, your colleagues, sometimes even your competition, but healthy competition is very, very healthy. Secondly, what about the education that you get out of it? And it also ensures credibility because you're learning from the top-notch doctors like Dr. Waldman, and all of his other colleagues, in addition to all the knowledge that you get that makes you credible. So, Dr. Waldman, let's start talking about networking, education, and credibility.
Well, networking to me, I'm glad you put that first because I think that's one of the things that you really can't get in any other format or forum. Networking, I often learn more in, as they say, in the back of the room than in the front of the room. We spend a lot of time with colleagues that are at the meetings and find out what they're really doing. They don't always talk about it on the podium. Maybe that's not their topic, but we can find out a lot about their practice, the state of the industry. And then it's not just networking with colleagues, Jay, it's networking with people like you, but it's also networking with our industry colleagues and friends, whether it's in the exhibit hall or somewhere outside the exhibit hall. And that gives us really a feel for which way the winds are blowing, which is really important. And again, I don't think that you can get that online. And it gets us out, and I think that's healthy. We were all imprisoned. I shouldn't use that word probably, but it's true during COVID, and
We were.
we were. And I think we learned what it was to get out of prison or to be in prison. And I don't think that most of us, after a few months, liked it. And I think that meetings allow you to go and network and be part of a really exciting industry.
I was very disappointed doing things virtually. It's just not the same. All right.
I did some podcasts early on to try to help people through dermatology times, if you remember, and had you on one of those podcasts. And it
Right.
was amazing the audience that we had because people were hungry for knowledge. Everybody was wondering, is this the end? Armageddon is here. And how do we navigate the legal landmines that are out there with our practices? I think that was a very valuable thing, one of the more valuable things that I've been part of. But it was a different time, and we were in our dining rooms and in our kitchens, and we were worried about the state of the world, the state of the industry. But when that time came and went, then I think it became even more apparent to most of us the value of live conferences and being able to get together with people. That's what we're made to do, and I'm a strong believer in that.
Yeah, I really missed meeting the people and the friends that I have seen all these years and sharing a lot of the knowledge. So when it gets to the education part, what was the vision that you had that said, you know what? I think business is important because many of these conferences have cadavers. Many of these conferences have the neurotoxin dermal fillers. Many of these conferences have, professional surgeons in the industry that are teaching their feeling of the newest and latest and greatest techniques, how to do specific types of surgery. Because yours was basically one of the first that was a surgical conference, not just an aesthetic conference. But what was your vision to bring education to the business side because you have concurrent in your conferences. There isn't a break that's just a couple hours here and a couple hours there. It is as full a track on the education of business side, physicians and non physicians. So, why that vision as a surgeon?
Well, let's start with the concept that I had early on, and that was that I got tired of being, an executive board for our society, and I actually got really tired of seeing the different specialties not interact. So Vegas cosmetic surgery really represented the very first true multi-specialty meeting. Now, as you know, what is a multi-specialty meeting? Well, it's not just having a surgical meeting with one or two invited dermatologists or one or two invited business people or oculoplastics. It's really about having something for everyone from each specialty when they enter the door to go to. That's a true multi-specialty meeting, and there are not many of them, in the world. So that's the first concept. But the second concept is that I am a practice CEO, a long-term practice CEO. I have a three-doctor surgical practice, two general plastic surgeons, and myself as a facial plastic surgeon. We've been together a long time, so I know, what the quandaries are out there. I look at it like, what do I want to hear as a doctor in the Midwest or the South, whichever you think Kentucky is? What do I want to hear when I go to a conference? And I know that I want to learn more about business, but more important, even, I want to take my staff to the meeting. and let them learn some of the things that I try to teach, but maybe I'm a little bit too busy in the operating room to teach them how to be the best patient coordinator, how to be the best office manager. I turn to people like you, Jay, to help me teach them in that type of environment. And when they go there, they're totally committed to the process. They're not sitting here answering the phones or anything else. They're there to learn. So it's not just for doctors, it's also very important that doctors consider bringing their staffs. We have, you know this, we have some offices, even the offices that you've consulted with, that bring 6 or more people to a conference. And I'll get a note afterwards and they'll tell me how valuable that experience was for them in many ways, not just the education, but interacting with other office staffs and asking them how they do things. So the networking goes well beyond doctors, it goes well beyond just industry. It now has evolved to go to our staff as well.
Very interesting that you say that because in the last meeting that you had in Miami Beach for Global, I had 6 of my team there. The purpose that I did that, it allowed them to network with other like-minded professionals, and my request to them is you don't have to go to the evening events, but you must go to everything during the day. All right. And during lunch, I don't want you to sit together. I want you all to sit at different tables so that you meet different people. You just might learn something. And they were blown away because they had never been to such a meeting where they were able to meet their peers and hear all different types of things. Let's talk about credibility. How do you feel having gone to meetings your whole entire career? Because I've been doing this for the last 15 years and going to different conferences in another industry prior to this. How do you feel that it gives people credibility?
Well, I think that, it gives the credibility becomes, with their colleagues, number one, and number two, hopefully with their staff, and then number three, with their patients. And so I think there's credibility gained by being an expert. And I think our patients like to know. We actually will put on, have our people answer the phone when I'm away, that Dr. Waldman's away teaching at an important medical conference that he organizes. You're making your doctor look like an expert, and that gives a comfort level to the patients that are on the phone. So that's an important thing.
I always think it gives people credibility because it allows you to know that you're going far beyond what you're already doing for more education. All right. So let's talk about trends that are shaping the aesthetic industry today, right? Insights from our industry leaders like yourself, access to the latest products, techniques, and technology. I have to share with you, and it's also staying competitive in a rapidly evolving field because I go to these different meetings and I probably do a dozen of these a year, and I am shocked at all the new devices, surgical, non surgical, aesthetic, that actually are in the industry. So, what do you feel are the trends that are shaping the industry now?
Well, that's the part about participating in what's going on in the exhibit hall and talking to industry about what products they've got in the queue and that type of thing. And I do a lot of that at meetings. I'm sure a lot of people do. It's a way of staying on the cutting edge, and that's really what your patients want. So I can go into a consult room and say, "Yeah, I've heard of what you're talking about, and I've looked at it very carefully. This is my opinion of it." And there's very little, because of the number of meetings that I'm involved with. There's very little that I haven't heard about. There's still some new things out there, and there's things that are in development, and that's the exciting part of it. The interesting thing is, Jay, and I have a great phrase as a surgeon: the more things change, the more they stay the same. And so we still have a place for the tried and true. We still have a place for surgery. Some of the latest developments, though, are somewhat, I guess, they're things that patients want to know about, and they want to know if they work. And we've got to be that interface to really have the credibility. And we go back to that word credibility of saying to them, "Yeah, I think that may be something that you should look at, or that we should look at, or no, I've checked that out. And I really don't think it's proven. I don't see the science behind it." And I like to, base my thoughts and my opinions on science. I don't like to experiment on patients. So some of the stuff that you get at meetings really tells you, does this really work? Is this really something that my colleagues are using? So if I'm thinking about a new technology, I'm going to go to 5 to 7 of my colleagues that already have it. And I'm going to say, okay, is it in the corner gathering dust, or are you really using it? And what's your ROI on that? Because in the end, there are practices and practices, and particularly the non-surgical practices that invest heavily in technology because it's what they offer. It's like if you only have a hammer in your toolbox, then everything looks like a nail. We've all heard that, and that's so true. So they go out and they buy all this technology, but the technology costs a lot of money. And I mean, you have to really look. Can I have an effective ROI in my community with my patient base? Is that my business model? And that's something that every practice has to determine for themselves.
It brings me back to, in my former practice. And for those of you listening, I'll make a disclaimer that I always make when I talk about my former practice. I am not a physician. I always make that disclaimer because I don't want people thinking, since I talk about my practice, that I am a doctor. In the state of Florida, you can be a partner or own a medical practice. All right. So, with that, I remember we were surgical, non-surgical, but we had about a dozen lasers in our office, for the med spa side. And every practice like us or something has a graveyard. So you have to be very prudent in your investment to see if you're getting your money back, because there's a version 2.0 and a 3.0 that's coming right behind as soon as you buy.
Let's take a quick break. Are you struggling with effective patient communication? You're not alone. Whether it feels like an afterthought or you're unsure of where to start, effective patient communication is key to a thriving practice. Don't worry, we've got you covered. Shorr Solutions now offers a fully tailored monthly or semi-monthly e-newsletter solution as part of our new email marketing package. Share your branding, services, promotions, and goals with us, and we'll craft a strategy and execute email campaigns that engage both new and existing patients. With our email marketing package, you'll build trust, foster loyalty, and bring patients back to your practice. Schedule a free consult with our team to get started today.
So now moving on, let's talk about unique knowledge that conferences offer, not just yours, but all of them. You have workshop panels, you've got Q&A, you've got legal panels, you have hands-on demo and practical tips to enhance your career. You know, how is it that when you speak about expert-led workshops, panels, and Q&A sessions, you've got an amazing team that helps with this, but how do you come up with this?
I spend a lot of time thinking about it. And to me, I like to think this anyway, but I think that what separates kind of our conferences from other conferences is that there's a continuity to it because it's always me. It's not a different chairman for every meeting. And that's what happens within the societies. And some put more work and time into it than others. I put probably 500 to 1,000 hours into each meeting that I do. It's my nighttime passion. I do it when I'm doing other stuff in my office at home. But I have to, I do a lot of it in between patients or in between surgeries. And I'm very fortunate to have a large network that I've developed. I've done 58 major meetings now that I've choreographed, if you will. Some under a society banner, and some under Vegas Cosmetic Surgery banner, and now under Multi-Specialty Aesthetic Conference and Global Aesthetics Conference banners. And my main push there, and the thing that I think separates what we do is content. And what do I mean by content? What's exactly what you just said. That's all content, but it's all different content. So if one of the dilemmas, and we all have to deal with lawyers, and I'm not talking about malpractice. I'm talking about HR. I'm talking about corporate organization. I'm talking about taxation. I'm talking about all those other things, and I could sit here and list everything that we have to use lawyers for. So we have occasionally we'll have a legal forum. As you know, you were part of it this last year in Miami Beach, and it may not be the most people in any track, but what people get out of that is a lot of free hours of legal counsel and advice. And we're fortunate that the legal people that come to us are the tops in the country that would be charging $1,000 an hour for consultation. And yet they open up and talk about all this stuff. And it's like a Cliff's Notes of what you need to know. So I'm using the legal forum as just one example, but there are many examples of how I see dilemmas within my own practice and what do I need to learn. And I think if I wasn't a physician and I wasn't the CEO and longtime director of my own practice and developer of my own practice. I brought in, now not as young as they used to be, but two younger plastic surgeons with me. So I have the experience of putting all this together, but I also have the experience of not knowing what I was doing with a lot of things and then trying to figure out how to share that with other people through experts like yourself or like the legal people that we have. And then my network of doctors, I think that I looked at it last year. I was playing around with it, and I think we have had well over 1,000 physicians over the years that have been part of it. It may be something like 15 or 1,700 different physicians that have been part of these meetings that I've done. So it puts me on a familiar basis with all of these people, and I know who the best educators are. But it's always what you don't know. So I will go to industry and I will go to people like you, Jay Shorr. You know that. And I may go to other people in your industry or other people in the pharma industry, and I'll say, tell me the up and coming speakers, because what I like to do with my meetings is to continue to add new and younger and energetic and hungry speakers to my forum, because I know that those people are going to work very hard to give a great presentation. So I'm always trying to refresh my faculty by about 25 to 35% each year. And that, and this year we have a long list of people that I've been fortunate to be introduced to for the next Global Aesthetics Conference. And, that's our bigger conference. That conference will have somewhere around 150 faculty members. The MAC meeting in Hilton Head was developed to have a smaller and more intimate type of meeting. We have about 55 or 60 faculty. So you can really get to know those people and sit with those people at lunch and pick their brains, because these are among the top dermatologists, plastic surgeons, facial plastic surgeons, oculoplastic surgeons, and even med spa owners in the country. So very excited about having a little bit of a smaller niche, because it allows me to interact with people a little bit more than it is at the larger meeting. I think that's the other part, that in our own practice, many people have taught us over the years how to treat patients. It's a different standard than in some offices. So in a plastic surgery office, our patient is somewhat a client. That's a bad word. We like to use the word patient, but it is a client, just like I might be a client of yours on a business side. So our staff learns how to treat people that come in and may put $20,000 down on the table for a procedure. It's a different standard. It's the Ritz-Carlton standard. And that's what we want to try to do. Well, we try to do that with our meetings. So what we've done is, instead of the society norm where it becomes like a governmental thing and a bureaucracy and they're there because they have to be, I want my staff to be there. They're the same staff that I have in my office. So they've learned to treat people in a fashion that they would want themselves treated. And so we try to welcome people to our conferences. We try to make it very user friendly. We try to have contacts that they're familiar with. And again, this is the staff that I train in our own office, and we just try to hold ourselves to a higher level. So it's content, and then it's the ability to treat our attendees in a fashion that they treat their own patients.
So you made a comment that you've done 58 of these, and I've only done 40 with you. So I want to know, where did I miss the boat?
Newport Beach, maybe. The Newport Beach conferences, the ski meetings. I don't think we've ever had you to those. And I did
Yeah.
about 6 of those. And then I did about 10, I think 8 meetings under the FPRS banner, as I was on the executive board of that group and program chair.
Yeah, I do 2 or 3 of those per year, but I'm sure glad that we're doing this in Hilton Head, because it's a hard flight to go out to San Diego. Plus, it's going to be a good time golfing. So, with the credibility that these conferences boost, you're able, with your faculty that you picked, the opportunity to present their own work, and the amount of CMEs that your conferences offer. I know a lot of the doctors, a lot of my clients, because I ask my clients to come there, they need X amount of CMEs, and I really don't know very many conferences. And like I said, I speak at a dozen of them where you can get the amount of CMEs in one meeting, all right, to help you meet the quota that you need for state licensure. And, lastly, I think it showcases your dedication to growth. And with the art of social media today, quite honestly, when you go to these conferences, and this is part of my team, by the way, Just so you know, I don't normally kiss on my staff, even though that is my staff. The woman that I am kissing is indeed my wife. All right. I want to make that perfectly clear so that people don't say, does he really do that with his staff? No, that is my wife. So, let's get into conferences that address real world problems in aesthetics. This next slide is for Med Talks is actually a true graphic that I took when I was lecturing at the conference, and naturally I was on Friday, but look at the actual schedule that you put together. And that was just in that one room because it talked about case studies, problem solving, how you have guidance on regulatory updates and compliance, just like you mentioned with the legal eagles that we had, that you can never, ever get as much information about what you should, shouldn't, and can't do. And then tips for managing client expectations and feedback. So let's talk about that for a quick second about how the conferences address your real world problems in aesthetics. How do you come up with these specific med talks?
Again, I think that the magic to it is that I've done so many. I've got a feel for what people want to hear. I have my own dilemmas in my own practice, so I know what I want to hear as a physician with a multi-physician practice in a fairly large environment. There's one other thing that I probably haven't mentioned. I know that you go to these types of meetings and all types of meetings, but there are trade shows and then there are conferences. And at conferences, you confer and you talk to other people, whether it's in industry or among each other. And I think that, more and more, there is a trend going towards more of a European model, if you will, which is the European model is more of a trade show that people go to, like the Las Vegas Electronics Show or the Las Vegas Car Show. Those are trade shows. And I think that that is a danger point at which I start seeing our meetings that are almost bought and sold and controlled by industry. And I'm all about our conferences being controlled by someone like me
Yeah, it's
who's a
called pay
physician.
to play, is my words.
That's exactly right. And I still think I'm still a big believer. Now, maybe I'm going to get, knocked off the pedestal at some point, and it's not going to be that way. And maybe I'm going to be the last of the Mohicans. But I still believe in content. I still believe in separation of industry. I still believe in pharma guidelines. I think they're there for a reason, and we follow them to the nth T. We're scrutinized by our accreditation group, and so it's very important to me to be what I'm usually term people usually refer to GAC or MAC as high end conferences, and that's the reason they're high end because of how we approach the model. That doesn't mean we don't have a vibrant exhibit hall. That doesn't mean that we don't need sponsorship money to keep the tuition low
Of course
enough.
we do.
We have to have that. But it's still driven by doing the right thing. And my whole philosophy is if I put people in the seats because I've got good content, then industry will follow rather than having industry drive the attendance. So it's still the content that drives the attendance. And that comes from, from what I see out there. It comes from the abstracts that people submit. We generally will get Jay, somewhere around between 600 and 800 abstracts per conference. And from those 800, then I've got to whittle it down to 200 to 300. I've got to mix it up with some panels so that I can try to engender a little bit of discussion and even some minor disagreements at times. We want to have, different opinions. And so it's just a feel for it. And again, I think that the difference is that it's the same person doing it all the time.
Yeah. Look, we all know that conferences, every one of them, needs to survive on vendors. All right. Make no mistake about that.
Absolutely.
And any conference that doesn't have vendors is not going to be a good conference. But one of the other reasons, before I became a faculty member, I used to attend conferences when I was not on the circuit because I wanted to see what is the latest and the greatest out there. So although it is it is a revenue stream for the conference owners and directors, the attendees want to see the different technology that's out there. I don't care if it's website, social media. I don't care if it's EMR. I don't care if it's non-surgical lasers. I don't care if it's instruments and tools. I come to see, now me from a practice management side, what can I recommend to my client base that's the newest, the latest, the greatest out there for the least amount of investment for the most amount of quality. And that's what the conferences bring. All right. It's a comparison of the vendors. It's all about, can it help you as a practice to increase, you know, your profitability? And that's why I ask you each and every conference for a discount code, as one of your marketing partners for my database of several thousand people that when I send it out, come to these conferences and you can get a discount on behalf of Shorr Solutions. All right. That's important. So, what personal benefits come from attending? We have success stories, we have renewed career passion, and insights to a new career path. Let's talk about the career path for a second for people that come in that are just getting into the industry. How does it help them to meet great physicians and surgeons like yourself and even maybe have a place in their world to work?
You just network with so many people in that exhibit hall and outside in the foyer outside the exhibit hall. It reminds me of my own practice that we're in the town with a large university, University of Kentucky, and we will, occasionally hire either part-time people for our front desk that are students or maybe right after school. They don't know what they want to do. They'll come work for us in the front desk. We know we're not going to keep that person long term. But I can't even begin to tell you how many people have worked for us not knowing what they wanted to do after school. And all of a sudden, you turn around, you look up, and they're saying, "Hey, I just got accepted into PA school. I got accepted into nursing school. I got a job with a pharmaceutical company as a local rep." It happens all the time, and I'm more proud of that. It's like your kids have gone and found something, found their passion, and found something in their life that they like to do, and that to me, that may be the highest point of my practice is taking young people in and showing them what we do and showing them maybe something different. And some of them started off as patients, but we enjoy success of those that work for us, and it's really the same thing at the meeting. People that attend the meeting that find themselves or find what they want, even if they're not physicians. We welcome, by the way, non-physicians to our meeting, and we have a lot of nurse practitioners or advanced aesthetic healthcare providers, as I think the more appropriate term now in our industry, which includes nurse practitioners and PAs and injectors and RNs and that type of thing. So we welcome those people to our meeting as well. We are in the business of educating and trying to make our industry better for our patients mostly. That's what we're trying to ultimately benefit is the patient. Patient safety is paramount, and we try to teach a lot of that. So, I'm very proud of the work that we've done over a number of years. And if we've had an effect, a positive effect on, the lives of our patients, then, that's a reward in and of itself.
Sometimes you never hear all those accolades, all right, but they're
No,
there.
but they're there. And I consider myself, Jay, I've told you this before. I consider, you say, what are you? I'm a choreographer, just as if you were choreographing a Broadway play or choreographing on a smaller scale a wedding. It's a matter of organizing and putting people together and putting them in the best position. And then ultimately look at the outcome at the end of the day and say, job well done, or I always come back from a meeting. My staff will tell you, and my staff will tell you that we'll sit and we'll have a roundtable and say, tell me the things that you thought were just great at this meeting, and then maybe we'll also say, and here's the things we want to do differently in 2025. So we always have a list of those things. We always try to make it better than the previous year. There is no perfection, but we try to get as close as we can, to that.
So, are you ready to invest in your future going into conferences? So, what's the next step for advancing somebody's career?
I love that. I love that word investment in your future. I really hadn't considered that. We should put that somewhere as a tagline. But so that was very creative.
Hey, I want credit. I want credit. I can use that at your next meeting.
It is an investment. Going to a meeting is an investment. You spend a little bit of money for the registration and spend a little bit of money for the hotel room. We try to have continuity in our meetings and at least have a nice destination that people can enjoy themselves a little bit. But we're very serious about education. So it is an investment in your future. It's an investment in your practice. It's an investment in how you do things. It's an investment for teaching your staff. It's a total investment for the practice. So I love that word. That's exactly what it is.
Great. As we wrap it up, I do want to put a plug in for MAC. All right. That will be in Hilton Head. And here I am at the last MAC conference. I think that was in San Diego. All right. As a Shorr Solutions attendee, we're offering a 10% off. Use code SHORR10. There it is on your screen. We're looking forward to March 27th to the 30th in Hilton Head, South Carolina for the Multi-Specialty Aesthetic Conference, MAC 2025. My personal thanks to Dr. Waldman. We go back a dozen years, maybe.
Yeah, it was when you were involved with your your late wife's dermatology practice, and you certainly are one of the leading people in our industry in terms of practice consulting and have a great reputation. So
Yeah, thank you. My personal thanks to you for allowing me to be in this now with you for 15 years of these conferences, minus a year or two break because of what I had to go through. But ladies and gentlemen, thank you for attending another episode of Shorr Solutions, the podcast episode number 123 with my special guest, Dr. Randy Waldman. Until next time, good luck. God bless. Don't go anywhere just yet. If you enjoyed today's episode, make sure to subscribe so you never miss the latest insights. New episodes are released every 2 weeks. For more valuable information and resources to elevate your practice, sign up for our e-newsletter. You'll get the latest industry updates, expert tips, and exclusive strategies straight to your inbox. Also, don't forget to follow us on social media at Shorr Solutions. If you're ready to take your practice to the next level, schedule a free consult with our team today. Thank you for joining us on Shorr Solutions, the podcast.